Okay. And then, as we said, once you get the data, you want to review the data set for relevance, quality, and suitability. Consider, things like completeness, reliability, and documentation. Assess data set for anxiety and depression. For anxiety and depression, prevalence rates, treatment outcomes, or whatever else you are interested in the context of anxiety, depression, and psychosis. To the right, I've got a couple of questions. What is one factor to consider when evaluating data sets for anxiety and depression rates? Or perhaps we could rephrase it to say, what are the factors to consider when you are looking at evaluating a data set for anxiety and depression? What should you do if a data set requires a registration process? So you're searching, you find out that, oh, this data set requires me to register. What should you do? Or if it says restricted access. On the flip side, you may find a data set that has been publicly shared, so readily available, you can download it. But when you look into it, maybe you're seeing some information that's disclosive of the persons who were involved in this study. What would you do? So these are things to think about as researchers. What are your ethical responsibilities when you advertently discover something in a data set that you have been given access to, whether by downloading freely on the internet or maybe you requested and you got it. So those are some of the things to think about. Okay. This is what I have on sourcing data and inventorying those data. These slides will be available. So maybe, Diana, we can have a couple of questions. The other thing that to make available is we have a document that we prepared, but it's related to COVID data. A lot of the content that's in there is relevant to searching for mental health data as well. So we'll make it available through the organizers of these sessions, so you can have a more detailed content, and then an example of you also get an example of a diary of contacts. So again, it's not cast in stone. It's something that you can use if you need a starting point. You can keep improving it. So over to you, Diana. Maybe we can take a couple of questions before we wrap up this part.
Okay. We have Edward, who has raised his hand. So probably you can unmute and talk and ask your question. Edward, are you there? Okay. I have Mr. Matagoro. You can unmute and ask your question.
Yes, thank you so much. This is Dr. Jabera Matagoro from Tanzania, and I'm glad to be part of this conversation and actually unpacking the very pressing discussion on mental health. I do work on artificial intelligence, and we have collected some few data sets. The only challenge I see, especially in Africa, is data sharing policy, because we have seen so many people doing research and project on artificial intelligence or mental health, but the issue is on sharing the data set. For example, in Tanzania, if we are dealing with the mental health-related data sets, you may be restricted to share them in the cloud or maybe abroad or somewhere outside the country because of the sensitivity of the data. So I just want to know to what extent the presenter have experienced that. Do you think data sharing policy would be a challenge hindering data related or data set, mental health related data set, or is something that we could try to unpack in a different way? Otherwise, thank you so much. The conversation is very interesting, and I'm happy to be part of this conversation because I also work on the same area. Thank you.
Thank you very much. Shall we take maybe 2-3 questions and then we can respond?
Okay. There's somebody who's asking, could we get the data set from these sources for free?
Okay, good question.
That's the only question I have on the Q&A. So please feel free to ask your question on the Q&A. And yeah, I think that's the only question I have so far.
Okay, good. I will attempt to tackle these. If I'm not mistaken, there is a separate module that looks into data sharing agreements. So maybe it can address more of the questions from there. More of the questions that were brought up. But thank you very much for that question. I think, yes, the policies around data sharing are likely to present barriers to accessing data sets. I think mechanisms or tools or technology for sharing data is now readily available, but we are still grappling, as you rightly mentioned, with the culture of sharing. It's not yet the norm. There are still a lot of concerns around what someone will do with data once they access them. I think from our little experience, that data sharing agreements can go some way in terms of giving the producer of the data a bit of comfort. They are not a magic bullet, but they help giving the producer of the data some sense of assurance that, okay, if I'm making my data available to a researcher who has given me their details, their affiliation in terms of their institution, then they are going to use those data responsibly. So data that are made available for scientific use, not just readily available for download over the internet, but that are made available after someone signs a data access agreement. I think there's more chance accessing those than data sets that are, you rarely find data sets that are just publicly available. So there's that aspect in terms of how are people going to use the data set when they access it. And then there's also the aspect of, well, I'm not too sure whether my data as they are not disclosive of the participants who provided me those data. So there are concerns in terms of when I share, isn't the information that pertains to some of the participants that I didn't want to disclose, isn't it going to be accessible? So people tend to, or even institutions tend to hold on to the data, not wanting to share because of those reasons. I don't know how much that answers your question, but it's an ongoing challenge that we have to keep addressing. If a data producer has some data that you're interested in, but they're not readily available, you may proactively have discussions around can we, can I support you in developing a data sharing agreement so that I'm bound to some requirements when I access your data? But also one of the options that maybe other modules within this series of modules will cover is to do what is called federated research. And I know that the Inspire network has been looking into this, and the APHRC, they've been looking into this. I don't know how far they've gone with this, but with this federated research, instead of getting some data to you so you can analyze the data, it's you take the analysis to where the data are. So getting to analyze data from their source, maybe by sending scripts. So that's one option that I know that the APHRC and Inspire was exploring in the past. And then the other question was asking, can we get the data sets from these sources for free? It's not one size fit all. I know with the World Bank platform, for example, you can, ask for access and then you get those data sets. You don't pay anything besides requesting and then being given access. But it varies. And it's not all the sources that I listed there that I visited. So yeah.
Okay, thank you for that. There's also another question.
Okay.
Someone is asking whether they can use data from an institution, from a friend, but the institution doesn't allow the data to be used, and how can they solve that issue? I don't know that.
Good question. I think your friend, it's not the right thing to do. It's an illegal thing to do. You can do it because your friend has the data, but it's not something that we are recommending here to get the data illegally. So because that's tantamount to stealing, right? So you even if your friend has access professionally, if your friend has access because they're working there, and they know that it's not permitted for you to use those data. I think to solve the issues, you have to request. You have to make a formal request. Most institutions, they restrict the data in terms of not just making them readily available for someone to download, but in a number of cases, when you make a request, usually, and you have a proper justification, your affiliation is known, you are a researcher, then with request, they, not always, but you in some instances, you get granted the data. So the right thing to do would be to make a formal request rather than just accessing the data from your friend. Because if you do that, what your friend is doing and what you both are doing is illegal. And also, how are you going to publish? When you publish, what data are you going to say you used? Because still it will come out when you publish that, oh, someone accessed our data illegally. So that's not good for you and for your friend. And it's not good for science, because science sharing data is really based on trust. We have to foster a trustworthy environment where we work. Okay.
Okay, those are the few questions I've gotten. Okay, there's one person, Yamikani, would like to ask a question.
Okay.
Yamuka, you can unmute and ask your question.
Okay, thank you very much. I'm Yamikani Sauka from the University of Malawi.
Okay.
Thank you for your presentation. I just wanted to encourage APHRC. It should not be a temporary thing when you share the slide. I think you should make an effort to organize this data set into your website. For example, you can have a resources page where we will access this data set, these links to the data sets from your page. I think you have managed to consolidate most of the experts in African mental health through this MH Data Prize. So consolidate these efforts by organizing a page, a resources page on your website, so that it consolidates all these links to the different resources on mental health in Africa, particularly the databases and the relevant sites for accessing the data. Thank you.
Okay. There are two other, thank you very much, Yamikani. There are two other questions here. Are visual or video mental health data sets available, or they are always text-based? Some studies do collect videos, but as you can imagine, these would be more restricted access. I'm not personally aware of sort of pictures or videos that are freely available, because I guess they are a little bit more difficult to manage. But maybe others in the audience who are working with this kind of data could weigh in. But yes, I know studies that collect these, and I can imagine if those institutions are contacted, they can give you details in terms of procedures to access. I guess in most cases, and this also goes to other data sets, not just the visual and video ones. For most of the restricted data sets, I think institutions may be more willing to share if it's a collaboration. If if at the end of the day, whatever analytics or research someone is gonna do, they are also gonna be acknowledged as maybe co-authors. So there's that aspect as well, to say, okay, instead of saying, oh, may I just save this data to go and do my groundbreaking research with it, maybe making requests for restricted data to ask for collaboration and to work together on a topic of interest. Perhaps that can open doors, because at the end of the day, the data producer will see that there's also value for them in terms of making progress with public publications or evidence generation. Okay. Okay. Can clinical reports of patients be used as secondary data sets? Yes, I think they can, but it's not just a matter of going to a facility or an institution that keeps this data and then directly getting access. There is need for them to be properly prepared for research purposes, because they are collected, during everyday work of attending to patients, and the doctors are writing to help them in their work. So those data as they are not readily usable for research, but a lot of research hospitals then do preparations of those data to make them available for research. And it's usually when there was consent already from the patients or from authorities that are responsible for the project that's sourcing those data. So the answer is yes, but there has to be some considerations. Okay, I think those were the questions. So Diana, are you there?
Yes, sorry. Yes, I'm here.
Okay,
yeah, I don't have any raised
additional.
hand.
Okay. So shall we take a break and then we start the other session in the next 10 to 15 minutes? What do you say?
Okay, in the next 10 minutes.
Okay, good. So
Okay.
we meet back after 10 minutes.
Okay.
Good. Or the user was intending for, we then say, okay, this data cannot be publicly shared. Maybe we put them under restricted access. Okay. So things to think about when you're quantifying disclosure risk. You have to think whether you're looking at population data or sample. Also need to think about what other data are already available from the same population. What are the scenarios that might lead to disclosure? You also look at individual and global risks. So some of the methods we apply at individual level, and then the other ones look at the data set as a whole. When you're applying the anonymization, you want to apply different techniques for categorical versus continuous variables. You also want to take into consideration the hierarchical structure of the data set. After you've done your anonymization and you think the risk has reached a level that's acceptable, you want to look at the before and after the anonymization. How are the risks? How is the use of the data set before? How is the utility before and after? And are people still capable of producing useful results from for the defined analysis? Because it's pointless to say, oh, here is the data set anonymized, but they can no longer do age-specific mortality rates, for example. Maybe someone is interested in children. You look at the data, you think, oh, they are very disclosive at that level. You then bunch all the people below 20 together, then they can't do under 5 mortality, for example. So those data for that purpose, they are no longer appropriate. Okay, something to keep in mind, the way we group variables when we're thinking of data anonymization. We already talked about the direct identifiers that we handle through pseudo-anonymization. And then we have indirect identifiers, which might be continuous variables or categorical variables. Someone's height, for example, might be an indirect identifier measured in centimeters. So that's a continuous variable. Or someone's weight or upper arm circumference and so on. When you think of that variable, in isolation, you might think, oh, okay, it's probably not a big deal. But then when you start to think of it in combination with other things, it might become disclosive. The real concern is to make sure that these so-called sensitive variables we don't end up finding a link between these sensitive variables and in particular individuals, such as the HIV status that I mentioned before.